Good morning, it's November 18th. This is To My Liberal Friends. For the past month during the shutdown, all politicians could talk about was health care. But it was not really health care that was on their minds. They were talking about insurance to pay for health care. And nobody was talking about the root problem of how much we're paying for health care. The question they should have been asking is, why does health care cost so much? Now, before we move on to that question, we need to understand one basic fact. The lifespan of people keeps getting longer. Today, the average lifespan of a person in the United States is right around 79 years. Think about that for a moment. About 100 years ago, that number was 65. When we live longer, we have more health issues. I read a study a few years ago that pointed out part of this problem. The average American will spend 75% of everything they spend on health care during their lives in the last 2 years of their life. And half of that will be in the final 6 months, and it will only get you a few months of low-quality life. Now, some politicians love to point to European countries with socialized medicine. They ignore all the problems in those systems and only point to the cost to the individuals. Never mind, you have to wait months to see a specialist, and those with enough money are now buying their own private health insurance. But there's also a different attitude among Europeans. They understand that death is part of life. But here in the United States, we believe we're immortal, and we're demanding every last measure to keep us alive even a couple of days, and that comes with excessive costs. When grandma's in the hospital, the doctors will tell the family what options they have, and the family will urge them to do everything they can to keep her alive. Not for grandma, because she will in many cases not even be aware, but because they can say we did everything we could. In these European systems, they do cost-benefit analysis. There are procedures you will not get as you advance in age. You're not getting a heart transplant at age 80. I have an acquaintance where I live that got a knee replacement at age 91. Think about that. That is thousands of dollars and something in Europe would never happen, never be approved. Going back to the basic question of why healthcare costs so much, there are some answers out there. One is the complete lack of transparency in the healthcare system. We don't treat healthcare like anything else that we buy. We don't look at the price. We just go to the doctor or hospital and accept the cost. In healthcare, the shopping experience for patients has historically lacked that type of transparency. People show up for doctor appointments or for a procedure at a local hospital without knowing what the doctor or hospital will charge. Most patients with private insurance pay only a portion of the cost of their care, typically in the form of a co-payment or co-insurance, so they're protected from having to cover the full cost. This enables providers to charge increasingly higher rates for their services while having to fear their patients will become frustrated and seek care elsewhere. Until just a few years ago, the rate providers negotiated with insurance companies were considered confidential, so self-insured employers that covered the cost of the employee's health care out of their own funds had no way of knowing what providers in their area were charging. These higher rates drive up the overall cost of health care nationwide, which eventually leads to higher premiums and out-of-pocket costs for consumers. Providers have leveraged these dynamics to set their prices higher and higher, a trend that's persisted for decades. Consider that since 2000, hospital prices have increased by more than 250%, which is twice the overall rate for medical care and triple the rate of inflation. But if you have health insurance, you don't bat an eye at the cost because, as I've mentioned, you only look at the copay that comes out of your pocket. The lack of transparency will become even more apparent when you look at some facts. Trillion Health, a healthcare analytics company, recently used data from two major health insurers to analyze inpatient and outpatient rates charged by nearly 2,700 hospitals and 3,500 surgery centers. They found that prices can vary as much as ninefold for the same operation or procedure. Even hospitals within the same state charge vastly different rates, sometimes as much as 3 times higher. As just one example, the cost of a total knee replacement can be as low as $12,000 or as high as $101,000, depending on the hospital you went to. Then we have another part of the equation, the lawyers. Doctors and hospitals have to play a game of CYA, cover your ass, when it comes to treating a patient. You may have a simple malady that is easily diagnosed, but the medical world is forced to run a large battery of tests that drive your bill higher and higher, just to be sure, because some lawyer will be suing them for malpractice if they don't. There have been attempts in Congress to pass tort reform to put some guardrails on these sharks, but the American Trial Lawyers Association have deep pockets and strong allies in Congress, mostly on the Democratic side, that prevent any limits on their ability to sue. So when Congress takes up the debate on health care subsidies, they should also be willing to take up the issue of how much healthcare is costing and look for alternatives that can reduce the cost and ultimately reduce the cost of insurance. That's part of the problem and something they have to look at in totality. This has been To My Liberal Friends. Thanks for listening.